we're here at, I guess, the completion of construction, the first one in the province. What does this mean for, I guess, the vision for these for Saskatchewan?
Well, I think it means a great deal for the services that can be offered, starting here in Regina, expanding to Saskatoon, and then I think there'd be a reassessment done and an eye to expand it beyond that. Really what is happening here is trying to fill some gaps that we have in healthcare on two fronts. One is that urgent care, that gap between the emergency room and your primary care physician or nurse practitioner that you might be seeing. And you see that gap being filled on this side of the facility and with the people ultimately working in it. The second really is starting to bring towards us towards better access into our mental health and addictions treatments. And that's what you'll see on this side of the facility. And a couple of months ago, as I mentioned, our mental health and addictions minister, Tim McLeod, had released the points of the mental health and addiction strategy that we have. One of those is to build capacity, rehabilitation and recovery capacity. You're seeing that happen with over 200 recovery beds built in the province on our path to our targeted 500 beds. A focus on access, which this building is working towards, is providing that access for people that may be having a mental health crisis or may have unfortunately entered a life of addictions and are ready to make a change, to have those that access point so that they can access those services immediately. So really feeling, I think, what are two gaps that we have identified in our healthcare system more broadly. First here in Regina, expand to Saskatoon, and I think in fairness we'd look for partners to expand beyond that once we have those up and running.
Can you tell me how the province is planning to staff the facility? I know in speaking to healthcare professionals, that is one of the major concerns, is there is a shortage of healthcare professionals, and a building doesn't necessarily fix that.
Right, and I will, Andrew can answer more specifically to the specific plans they have on staffing this facility, but more broadly, what we have done as a government is put in place, in partnership with our Ministry of Health and the Saskatchewan Health Authority, as well as the individuals in the Health Authority, the Health Human Resource Action Plan. This was started well over a year ago. It's had in excess of $100 million put behind it, focusing on retraining people that are already in healthcare to achieve a higher level, or training people to go into healthcare. And we've seen that with the expansion of healthcare training seats across, I believe, 19 different disciplines, over 550 different seats that have been expanded through our various post-secondary institutes. And Mayor Masters had spoken to some of the web of work that has to happen in order for this to be successful. There's immigration initiatives that are happening, and there are hiring efforts that are happening not only abroad but happening in Canada. And I would point to one of the more recent statistics that was released just over a month ago, where there's been about 1,000 Canadian nursing grads that have been hired by the Saskatchewan Health Authority in the last year. In addition to that, over 450 Filipino nurses and other practitioners have been offered positions within the Saskatchewan Health Authority as well. About 170 or 80 of them are on the ground offering those services in a Saskatchewan community and facility today. And so our Health Human Resource Plan that we had put in place to train, to recruit, to incentivize folks to come into a facility like this or across the healthcare system in rural and remote locations that we've had some challenges in recruiting folks. It is working. And it is showing results in those numbers that I had just provided. And I would say that it's also showing results where it matters in, for example, the reduction of our surgical wait time, down 23% over the course of the last 2 years. More work to do. Certainly, as all of our surgical wait times have ballooned, I would say, through the pandemic period, not just in Saskatchewan, but across the nation of Canada. But I would say when you put Saskatchewan's as a province, the reduction in the wait time that we have relative to other provinces, we're doing well. And one of the reasons, and I would say largely the reason that we are finding a shorter wait time here in this province is due to the success of the Health Human Resource Plan. So the funding and the initiative is put by the government, but the actual boots on the ground, so to speak, and what is resulting in people coming into our facilities are the individual initiatives that are happening within the Saskatchewan Health Authority, and Andrew can speak to those. The Ministry of Health is involved, but I would say also immigration and career training is part of this. Gord Wyant, I don't know if he's here, is the Ministry of Advanced Education was part of this in expanding some of the training seats that we have across the province. The physician training seats were expanded by 5 again this year as well, up from 60 when we formed government. So those are just a few examples of the higher level, more broad based initiatives that the government has put in place, the funding that has come in behind that. But Andrew, when he comes, would be able to speak to some of the specific initiatives that the Saskatchewan Health Authority is taking broadly across the region, but also specific to this facility as well. That's a short answer to a long question.
How much funding is the province has already put into this facility, and will there be annual funding that goes into it as well?
Yeah, annual operational funding, 18.7 million, 18 million dollars will be the operational funding. There will be in excess of, I believe, of a couple hundred people that will be employed, but 125, pardon me, that'll be employed in this facility. So that's in addition to the construction cost that is, and the furnishing cost, which is substantial as well. And many thanks to the Hospitals of Regina Foundation for their partnership in that.
Because you're here in front of microphones, I just wanted to ask you for your reaction to the Prime Minister's reaction to your letter to wanting that First Minister's meeting on the carbon tax.
And what did he say? No?
In many words.
Listen, I think there's 7 premiers now that have asked for a First Minister's meeting. I don't know what the challenge is. Let's sit down and talk about a real path forward that isn't causing economic harm to Canadian families, is causing economic harm to the industries that are creating value and creating wealth in our communities across this nation, and is really, in many ways, creating division across this nation as well. When recent decisions have up until recently, I would say that this has been a terrible economic policy, an ineffective environmental policy that has, at the very least, tried to be applied fairly across the nation, and recently what we've seen is that attempt isn't even there anymore with some of the decisions around home heating fuel. And so there is other paths forward, and I have spoken at great length of this in the Saskatchewan legislature, nationally, internationally, most recently at COP28 in Dubai, about the role that Canada can play in reducing emissions globally. And reducing emissions globally is precisely what we're doing here in Saskatchewan in the industries that we are operating in. We are producing the most sustainable food that you can find on earth, a 65% lower carbon content than the next 7 largest producers of wheat and canola, 92% lower carbon content on a per ton basis than the next 7 largest producers of field peas globally. Our potash in this province not only is produced more ethically than anywhere else in the world, but it's produced with half the carbon content of other potash. And so, as I always say, if you need another ton of potash, you need something to eat, or you need some uranium for your nuclear power plant, your zero emissions nuclear power plant, you should always look to Saskatchewan, not only because is it a high quality, cost competitive product, but you should look to Saskatchewan because it's the most sustainable product that you can find on earth. This is a path forward if you truly believe that climate change is global and doesn't stop at the provincial borders or doesn't stop at the Canadian border. The United States of America seems to be reducing their emissions without a carbon tax. So for the Prime Minister has said oftentimes that all the premiers need to do is put forward their own plan, and he'll remove his. Well, it doesn't matter who's charging. The plan has to be within his parameters of charging a carbon tax. So you change the name on where the carbon tax is submitted. It doesn't change the damage of that policy. It doesn't change the ineffectiveness of that policy from an environmental perspective. What we're saying is, and what we're asking for from Saskatchewan's perspective, and I know many other premiers, is let's sit down and actually have a discussion about what will be an effective environmental policy with much less harm, economic harm to Canadians. And our concern is the economic harm that's happening to Saskatchewan residents, whether that be directly in what they're paying at the fuel pumps when they take their children to an extracurricular activity, or whether they take their children to the hockey rink, or whether it be the harm that is happening to our investment environment here in the province. And we're doing very well in that space, and I would say it's despite policies like the federal government's carbon tax, not in light of those policies. Further to all of that, it has always been claimed by the federal government that it's the most affordable environmental policy, or the most affordable way to reduce emissions. And there's been some misquotes, actually, and I maybe should have been clearer at the committee with respect to some comments I made about we had looked at some other policies, but they all cost more. We looked at some other policies that would be within the framework of what the Prime Minister has put forward as being acceptable from their decree, and they're all costly to Canadians. They're all costly to industry. There is another way, and there is another path forward on recognizing what we are already doing here in this province, and sharing that innovation and sharing that technology with other nations. And an example of doing just that is the second last time I was in India. I was standing in a farm with a number of Indian farmers on a drill that was built in Saskatoon, Saskatchewan. It was the latest technological advancement in zero-till drills that you could have in seed placement and fertilizer placement, allowing here in this province us the ability to sequester soil through zero-till agriculture. They'd sold 1,000 of those drills, Canadian-built drills, Canadian-built innovation to farmers in India. And we're standing on that drill right out there where now they are going to have the ability to produce the food that they make in India in a much more sustainable fashion than they have previously. And what they've done previously is burn the residue, which from an environmental perspective is exactly what you shouldn't be doing. So one example of how through commerce, Saskatchewan actually is part of the solution in reducing our emissions globally, rather than worrying about taxing Saskatchewan families and Saskatchewan industries and Canadian families and Canadian industries into submission. So that's the conversation that we've asked for. And quite frankly, I think when 7 premiers ask for it, one of them being a Liberal premier, we expect to get that meeting.
Sir, similarly, while you're at the podium, I've been asked to ask a question for a colleague of mine, Alexander Kwan, and he wants to know if you're aware or to respond to allegations of membership purchasing in the lead up to the Martinsville meeting. Are you aware of anything around that?
Yeah, I am, and I would say that the individual involved removed himself from the race, so he wasn't a candidate in any way. We have rules around, as all political parties do have rules around membership purchases, and we expect those rules to be followed and anticipate that they will. We also have rules around, like all political parties, around the conduct, and we have an ethics committee that looks into this, around the conduct of potential candidates and ultimately people that might be on the ballot as a candidate. And so looking, this individual did remove himself. He wasn't a candidate. And with respect to the rules around the membership purchases, you know, we feel that those have been followed, or have no evidence that they haven't been. But all parties do this as well. You know, there was another party that removed a candidate in their Kenora race, actually, and the second place individual was named as their candidate in that space. And so there, you know, this does happen from time to time, despite the best efforts of all parties in vetting not only candidates, but putting in place the most stringent rules around things like membership purchases and whatnot, and still ensuring that you know, all Saskatchewan residents have the ability to participate in the democracy that we have, which starts with party nominations.
All right, thanks everybody.
Thank you.